Welcome everyone to this presentation on psychometric tests and diagnosis in TA practice. It will be advisable for you to see the video on Introduction to Psychometry before you listen to this. This is meant for advanced learners of transactional analysis. At the end of listening to this video, you are expected to be able to identify the theories of psychometry, current and historical. You will be able to identify some psychometric tests, and you will be able to identify the nature and diagnosis of psychometry in TA practice. You will be able to list some of the benefits of psychometry in educational TA practice. Psychometric tests are based on a model that portrays intelligence as a composite of abilities, and it can be measured by mental states. Broadly, there are two types of psychometric tests: the personality tests and the aptitude tests. Here we will see some of the theories that were used earlier for psychometric tests. Common factor theory of Binet, primary mental abilities theory by Thurston, hierarchical theory of Jensen, fluid and crystallized intelligence theory of Cattell, and the two-factor theory of Spearman. These were the earlier theories used to design psychometric tests. The theories used nowadays to design psychometric tests are the following: Guilford's theory of structure of intellect, Howard Gardner's theory of multiple intelligence, Spearman's two-factor theory is still used, statistical and mathematical models and theories to provide validity, reliability, sensitivity, and specificity for the tests, and item response theory. Here I am not going to go into the details of all this. I am just mentioning them here so that those who are interested can go and read about these theories in detail and learn about them. These are some of the personality tests that are very popular in the present times. Those tests cannot be taught here, and those tests cannot be done here, but they are available on the internet. Those who are interested can go and try them. And some of them are named Enneagram tests, Myers-Briggs test, the Big Five tests, DISC tests, career aptitude tests, love styles, emotional intelligence test, and workplace tests. And here I am showing you the URL for getting all these tests. You can access the internet and do these tests. These are some of the aptitude tests. Like I said earlier, there are personality tests and aptitude tests. So the aptitude tests are primarily focused on specific skills. So as you can read in these titles, they are focusing on specific skills like situational judgment, logical reasoning, spatial reasoning, diagrammatic reasoning, abstraction ability, mechanical reasoning, linguistic aptitudes, your skills at inductive reasoning, skills at deductive reasoning, spatial reasoning, cognitive ability, clerical ability, multiple intelligences. So many of these skills are being tested in this aptitude test. So these tests are designed for hiring people for jobs specifically where each of these skills are important. They are also useful to help you assess how skillful you are and assess your career aptitudes also. So that is why these tests are designed and available. So you can, if you are interested, you can go and get yourself tested on these tests. There are free and paid sites where you can do these tests. So search on the internet, name these tests, and you will be able to access them. Coming to diagnosis in psychiatry and psychotherapy, it is different from psychometry. Psychiatrists make a diagnosis of mental health problems and provide medical treatment. And here you need to recall the DSM criteria and the ICD criteria for how these diagnoses are made. Mostly they are made based on symptoms and um, difficulties expressed by patients. Psychotherapists also make diagnosis using some of these criteria and design treatment. The difference is only in the kind of treatment that is offered. Psychiatrists offer medical treatment and psychotherapists offer verbal treatment. Clinical diagnosis is made from symptoms presented by the patients, and the priority for that purpose is to treatment. Whereas psychometric procedures are useful in improving the theoretical rigorousness or academic rigorousness of the theory that is being used for diagnosis. So quantification is fairly rigid in psychometric procedures, whereas in diagnostic process, the same kind of quantification is made, but it is not a rigid process. So the major difference between diagnostic methods and psychometric methods are in the quantification and objectivity, which is meant for the academic rigorousness. Whereas in therapeutics, the priority is patient's treatment, and so the diagnosis is based on symptoms and difficulties presented by the patient and proceeds. So psychometric measurements may be helpful for diagnosis, but they are not essential. And psychometric measurements can be used also to assess the clinical improvement of the patient after therapeutic procedures. The diagnostic process in TA practice is based on the structural and social phenomenon of the human mind. Eric Berne, whenever he used the word diagnosis, he meant identifying the ego state of the client. Because of the simple language that TA uses and the magic of the simple language, the client is often subjectively easy for the client to identify his ego state. Even though objectivity is very important, that's not emphasized because it's easy for the client to identify his ego state. So the emphasis of TA clinical practice in the diagnosis point of view is always diagnosing the ego state. Later, many theorists developed tools for identifying the stroking pattern, measuring the intensity of the script injunctions, the life position pattern, etc. But they are not very important from a diagnostic perspective for therapeutic interventions in TA. Here we can see what are the ways in which therapeutic interventions are practiced in TA. Since most mental health conditions are explained in TA using the ego states, transactions, and their dynamics, the therapeutic processes are also based on releasing the adult ego state or facilitating more use of the adult ego state and liberating the child ego state from the limiting influences of the parent ego state. The theories of stroking, script injunctions, life position, etc. are useful in developing therapeutic interventions in TA. And the objective measurements of TA characteristics like life position or ego state or stroking profile, typically known as psychometry in TA, they are not essential for clinical diagnosis and treatment, but they are useful for measuring the progress of the patient after treatment, and they are also very useful for establishing the academic rigorousness of the TA theory. Eric Berne always wanted research in TA, but he was not very keen on measuring without the consent of the clients. So most of these tests have been designed by later TA theorists, and these are some of the references to TA psychometric procedures that are available. Those who are interested, please go to these references and read these articles and build on your ideas on psychometry in TA. Now coming to the use of psychometry in educational and organizational practice of TA. In educational practice of TA, sometimes psychometry is helpful in guiding people to what kind of education they should proceed or what professional education they should proceed to and things like that. And so also in organizational TA practice, It helps the practitioners to guide clients to choose a career, or how to get promotion in a career, what skills should be promoted, etc. Now coming to an exercise to assess yourself what you have learned from this video, please answer these questions. So what are the common characteristics in diagnosis and psychometric measurements? What are the differences between psychometry and diagnostic process? What are the advantages of psychometry and diagnostic process? What are the disadvantages of psychometry and diagnostic processes? And how is in TA practice psychometry used, etc. Thank you for listening to this video. I hope this has been useful to help you to understand some ideas about psychometric measurements and how psychometric measurements are practiced in TA. See you again in the online sessions.